Artificial hydraulic urinary sphincters have been considered the gold standard for the treatment of male stress urinary incontinence and selected cases of female stress urinary incontinence. The satisfaction rate is more than 90%. However, we still see a significant rate of reoperations. The main problems are subcuff atrophy and/or erosion into the urethra. Based upon the works of Fernando Garcia Montes and Michael Craigs, urethral blood flow appears to be a key factor for both continence and prevention of atrophy and erosion. Therefore, adjustment to the lowest pressure needed to provide continence should assure optimal long-term results.
The Victo adjustable urinary sphincter consists of a urethral cuff, pressure regulating balloon and a pump which is equipped with a port for percutaneous adjustment anytime after the implantation. The system pressure can be adjusted from 0 to 100 centimeters of water. For patients who are unable to interrupt their stream, Victo Plus is offered with an additional stress balloon which is placed in the preperitoneal region. Thereby, abdominal pressure peaks are directly transferred to the cuff. Both versions are delivered pre-connected.
Pre-operatively, we place a 14 French red rubber catheter for easy identification and isolation of the urethra. The operation is started with a perineal incision. The musculus bulbus spongiosus normally is divided. In cases of advanced muscle atrophy, this step may be abandoned. Once the urethra is isolated, the circumference is measured using the measuring tape, which is provided in the accessory kit. Once the size is decided upon, the approach to the inguinal region is commenced. For filling of the implant, the pump is deactivated using a soft vascular clamp. The filling and evacuation of air can easily be performed using two 10 milliliter syringes filled with 10 and 3 milliliters for the Victo, or both filled with 10 milliliters for the Victo Plus. Isotonic contrast medium or saline may be used. Air should be removed, however, tiny bubbles do not change function or pressure of the implant. We are lucky to have nurses who help us doing the filling process of the system while the surgeon already approaches the peritoneum. The pressure regulating balloon is placed intraperitoneally in order to avoid capsule formation that might influence the system pressure. When implanting a Victo Plus system, the stress balloon is positioned preperitoneally. The transfer of the pre-connected cuff to the perineum is commenced using a camera bag and a clamp. Positioning and closure of the cuff is easily performed with a mosquito clamp. The tube to the cuff lies parallel to the urethra, thereby avoiding possible oblique forces, increasing a possible risk of erosion. Finally, the pump is positioned in the scrotum by blunt dissection and the wounds are closed.
We have been using the Victo now for 1 year and we feel very happy about the possibility of lowering the system pressure to the lowest level necessary to provide continence. We have done 25 cases so far, 10 of which were Victo Plus. And after 1 year, of course, we cannot state anything about long-term results, but what we can say now is that we had no single explantation and that all patients who are activated are either significantly improved or dry.